Everyday skin grafts are used to help those recovering from serious injury, trauma, and in some cases even cancer surgery. But there are several different types of skin grafts, each used for a variety of reasons. Dr. Michael Kim is here today to tell us more about that procedure. Good morning, Dr. Kim.
Good morning.
I didn't realize that there were multiple kinds of skin grafts depending on the severity.
Yeah, I have this conversation quite often with patients when they come in with a large wound or trauma or skin cancer. And so, here's a burn patient. So basic types of skin grafts are autografts taken from our cells. Other types of grafts we use less commonly, allografts taken from cadavers or dead people, which often doesn't take, and then xenografts from different species like pig skin or cow skin. This is a perfect example of a large burn wound, which if it's a full thickness burn requires excision and a skin graft. And since it's such a large area, we have to rely on split thickness skin grafts. So basically, we take a planer, looks like a dermatome, a planer on the leg or wherever we're taking it from. We plane a very superficial piece of skin, as you can see on the left bottom. It's like this little planing device, and it just strips the top layer of skin, and then it can be meshed. So 2-to-1, 3-to-1, 5-to-1, so that it covers a larger area, so that areas like on the leg and large areas can be covered. The advantage is that you can do a large area and it takes better because it's very thin. The downside is the morbidity of the donor site, because you have this huge open wound. Kind of takes a couple weeks to heal, very sore, leaves a large postage stamp type scar on the leg. You can see people with the legs, they have the big square scars.
Sure.
The next slide, I think, that shows other types of grafts. And so when we have skin cancers, often in the face or the hand, I often like to use full thickness skin grafts because the skin is thicker, it doesn't contract, and it looks better at the end result. You can see on the bottom, on the top right. However, usually we're limited to how much skin we can cut out, because the full thickness, basically, if you remember, the skin is made of epidermis, dermis, and subcutaneous skin, is that we cut an area of skin out and we close it with stitches. So certainly in the groin, there's lots of areas. In the neck, we can cut out a lot of skin and use it and just put it in the area. So these are called full thickness skin grafts. And again, they don't contract, they look better. Certainly on the face, we like to use those.
What is the type of scarring if you do have something like cancer on your face and you do that type of grafting? Are you going to see a noticeable line or marking?
It depends on the patient and how big the scar, the defect is, but in general, depending on the color of the skin and the color match of the skin graft, you usually be surprised after about a year. It's very hard to tell sometimes where the areas of skin graft. Of course, some areas where you have divots, and this is called a composite graft, where we take not only skin, but skin and cartilage from the ear. And in certain areas like the nose, where it has a full thickness defect, we can put a little piece of what we call composite, meaning skin and cartilage, and put in there, and often will take, so it gives a nice result.
Really amazing what you can do nowadays. Thank you so much, Dr. Kim. We appreciate it. All this information is on our website, weeknews.com. We're going to be right back with a check of your weather and traffic on this morning's top stories. It's 8:24.